Let's explore another part of the human body with Dr. Matt Barton and Dr. Mike Todorovic from Dr. Matt and Dr. Mike's Medical Podcast and their YouTube channel. Evening, gentlemen.
Hello, Cal.
I'm doing very well, surprisingly enough.
Good to hear.
Now, National Diabetes Week starts from July 12 through to July 18, and this one's a bit close to home for me, of course, because I have diabetes too. And actually, I was talking to one of the people from Diabetes Queensland, and they said not many people admit to having diabetes too. Not many I don't consider myself high profile, but in the public eye anyway. People admit to it, which I thought was kind of strange given that, well, a lot of people have it and are dealing with it, or even worse, don't know they have it and should probably be tested for it. So we're going to talk diabetes this week. I imagine you have 3 questions for me.
Yes, I have 3 true and false questions for you.
Okay, now do I get the answer now or do I wait till later?
I think wait till later. We'll be able to answer at some point along the
track. Okay.
All right, number 1. Eating foods high in sugar causes diabetes.
I'd say false.
Okay. Type 1 diabetes is the most serious form of diabetes.
Oh, I'm going to say true to that. They're both serious, but type 1 can really mess you up fast.
Okay, number 3, diabetes is caused by a dysfunctional pancreas.
Well, I'm sort of thinking, does a bad worksman blame his tools? I'm going to say, I'll say false. I don't think it's a dysfunctional pancreas, but I could be wrong. I could not know my own disease at all, as it turns out. All right, so there are our questions. We'll get some answers. Let's kick off. Just what is diabetes?
All right, so the word diabetes basically means to siphon. Now, traditionally, what it meant was you just urinated a lot. But they didn't really know what the cause of the urination was. So there was, generally speaking, 2 main categories historically what diabetes was. There was diabetes mellitus and diabetes insipidus. Mellitus means sugary, and so it just meant you were siphoning a lot of sugar. And so the doctors back in the day, they would only be able to kind of diagnose this problem by tasting the urine. So the person is urinating a lot,
yes.
But one either tastes sugary or not. And the typical diabetes that we refer to today, that's diabetes mellitus, which is usually associated with a problem managing blood sugar levels, whereas the insipidus has got something more to do with the hypothalamus and the pituitary gland, which is a problem with regulating water balance.
Okay.
So when we look at diabetes mellitus, and this is what next week's all about in Diabetes Week, Awareness Week, essentially diabetes mellitus is a group of diseases that basically impacts the way that fats, proteins, and carbohydrates or sugars are processed in the body, which results in essentially a high blood sugar level. And when we look at that, there's kind of 3 main types. There's type 1, there's type 2, and then there's another one we call gestational diabetes, which is to do with pregnancy.
Okay, so what's the difference between type 1 and type 2 diabetes?
So type 1 diabetes used to be called juvenile diabetes or early onset diabetes because the majority of individuals who were diagnosed with type 1 were younger individuals. And this is a form of diabetes where the pancreas, produces little to no insulin. So there's a bit of problems with the pancreas there. So I'm not sure whether you get a dun-dun or...
You'd probably say type 1 is a dysfunctional pancreas.
I would. But in saying that, type 2 diabetes, which is adult onset diabetes, is characterized by an increased blood sugar level, but insulin resistant. So the pancreas is, at least in the early stages, relatively fine, pumping out insulin in response to these calories coming in, particularly glucose. But what happens is the bodies and the receptors become resistant to this insulin. And over time, if going unmanaged, the pancreas can actually become damaged.
Okay, so I was wrong. It is a dysfunctional pancreas?
if we're looking at type 1 diabetes, I know we do this to you all the time. If you were thinking type 1, then you were wrong. But if you were thinking type 2, early stages, I'll give it to you.
Let's give it to me, shall we?
Yeah.
It's just one of those things where the pancreas does work and then it kind of doesn't. And I'm thinking, like, my thinking on this was always that I just overloaded it, that it was just going, oh my God, I can't keep up with you. And I've done the best I can, and now I'm just giving up.
In a way, with type 2, seems to be predominantly an abundance of calories coming in.
Yep.
So it's not necessarily just sugar. It seems to be excess calories or extra calories, and this can come from carbohydrates, which gets broken down into basic sugars and glucose, fats and proteins. And so in a way, yes, it's sort of overburdening the pancreas to pump out a lot of insulin. And the way that the body responds is if you always boost something up, the body always wants to maintain homeostasis, maintain a happy, healthy balance. So it tries to do whatever it can to dampen the response. And so what it can do is play around with the receptors that usually pick up this insulin and just make them less receptive to it. And the problem with that is obviously the fact that certain cells of the body or tissues need insulin because insulin's the key to open the door to these cells to pull glucose in so our body can use glucose for energy. And so there's certain cells of the body that must have insulin in order to do this. There are other cells of the body that don't necessarily need insulin, like the brain and liver don't necessarily need insulin to take sugar in, but other tissues like muscle tissue, for example, definitely do.
So what are the signs of diabetes?
They can be fairly varied, but in terms of type 1 and type 2, there's certain ways that you can remember it more easily. So sometimes they refer to the 3 Ps, and literally one is you're doing a lot of peeing.
P.
So this is, they've got poly in their name. Poly just as a prefix means many or a lot. And so polyuria is one, which means a lot of urine. Polydipsia, which means you drink a lot, and polyphagia, which means you eat a lot. And so usually both types, type 1 and type 2, will have those 3 Ps associated with it.
So in a way, it sort of becomes this cycle, doesn't it, that your body wants more water, then you pee more, and then it's also hungry, so you keep eating, which, depending what you're eating, but most things will break down to a sugar eventually anyhow, let's face it. Even carbohydrates, if you're thinking, no, I'll eat that bit of bread or I'll have that pasta or that bit of rice, that's all breaking down as well. That can up my blood sugar level just as fast as an ice cream can.
Yeah, well, if you think about the digestive processes, you've got to break down the most complex of the nutrients are proteins, fats, and carbohydrates. And so you've got different parts of your digestive tract break different macronutrients down into their basic, primary, smallest components. And that's what we absorb and usually use for energy or building blocks of the body. And like you said, carbohydrates will break down to sugar, ultimately glucose. And straight away this happens in the mouth. So it's the first port of call. So you could just get a piece of bread, put it in your mouth, not even chew it. And after a while, once that bread starts to turn a bit mushy, it starts to taste sweet. And that's because the enzymes in your mouth that breaks up the bread releases glucose. And then as soon as you swallow it, that's going to get absorbed through the intestine straight into your blood. Your blood glucose levels go up. And so, it really depends on where in the digestive tract all this is occurring.
Now, what about type 1 diabetes then? What's happening there? Because that's not diet related, is it?
No. So type 1 diabetes is, like I said, previously known as early onset because the majority of individuals, usually teenagers or a little bit younger when this onset occurs, but there are a number of cases of an older onset type 1, so they've sort of pushed away from using the term juvenile onset.
And just to add there, they've actually, in some circles, they've come up with a diabetes 1.5. I'm not sure you've heard of that.
No.
It's actually called so some scientists will refer to diabetes 1.5, so it's a bit controversial at this point, but it is a type of, type 1. It fits into that category where your pancreas beta cells, the beta cells are what produces insulin. They've been worn out, but the diabetes 1.5 seems to be what we call a latent autoimmune type of diabetes, which means it comes on after the age of 30, but it seems that the individual has an autoimmune condition where the the body's immune system is attacking those cells.
Oh, wow.
But unlike the typical type 1, it's happening later, as Michael referred to.
Yeah.
And so the earlier onset for type 1 is also an autoimmune disorder and has some significant genetic components associated with it. And so basically what happens is, by no fault of the individual, the body is recognizing the cells of the pancreas as being foreign and attack it as though it's some sort of invading pathogen or disease, and kills it off. And so no more insulin is being produced. So like you said, Cal, it's not necessarily something that can be significantly managed through diet, for example, like type 2.
Yeah. ABC Radio Brisbane and Queensland, you're with Kelly Higgins-Devine. This evening, it's a look at the human body, and tonight we're talking about diabetes because National Diabetes Week is happening from July 12 to July 18. There are lots of people that have diabetes, but lots who don't know they have it as well, and we might talk about that in a moment. With me, of course, Dr. Matt Barton and Dr. Mike Todorovic from Dr. Matt and Dr. Mike's Medical Podcast. They've also got a brilliant YouTube channel you should have a look at as well. It is brilliant. Lots of people subscribe. Now, type 1 diabetics then, how do they control their blood glucose levels?
So because they're usually diagnosed at a young age, they're taught, it's basically through education, they're taught to monitor and manage their own insulin. So in actual fact, because they're not producing enough or any at all, they need to take what's called exogenous insulin, so insulin from outside the body, and it needs to be introduced into their bloodstreams either through a syringe or a pump. Now, obviously, the amount of insulin we normally produce is dependent upon the calories that we ingest and the blood sugar levels of the body, for example. And so this also means that the individual needs to monitor what they're eating and their exercise as well, because all of this needs to be taken into consideration when it comes to trying to tweak the amount of insulin that they need through their syringe or pump.
Okay. Now, type 2 diabetes, there are lots of books that talk about reversing it. I'm not sure if curing it is quite right, but they talk about people, losing a lot of weight, for example, if weight is one of the issues for people, and actually being able to go off their medication, that their pancreas can sort of go, oh, okay, I'm not working so hard now. Well done, you. Is that true? Can that happen for people who are type 2?
Yeah, I think you explained it quite nicely, actually. You said that.
I've read a lot of books on this topic.
So, yeah, I don't necessarily like the word cure, but I think reversal is definitely a better term to use. And so, like you said, so because type 2 is a condition caused by an excess of reversible fat accumulation, this fat's accumulating in both the liver and the pancreas. And so within the liver, this excess fat basically stops the liver from being responsive to the insulin. And because the liver's the primary site of glucose storage, it starts to pump out glucose that it's stored because it doesn't realize that there's already glucose present in the system. And so it's mismanaging glucose because of the excess fat in the liver. But in addition to that, because there's also fat at the pancreas, the cells that make the insulin at the pancreas seem to go into this survival mode, and they fail to function properly because there's this fat-induced stress. So like you said, removal of this fat, usually through weight loss, so diet and exercise, can reverse this at least in the early stages of type 2. So the reason why I'm saying early stages is because if it goes poorly managed or unmanaged for too long, the pancreas itself can start to act as though it's a type 1 diabetes case, and the cells can actually die off. So it goes from this insulin resistance to this reduction in insulin production and inability to produce insulin. And so some type 2 diabetics actually need to take exogenous insulin.
And I think, just to add on that, I think this is part of the reason why we've changed the term. Type 2 diabetes used to be referred to as non-insulin dependent diabetes mellitus, or NIDDM. And the fact that some type 2 diabetics actually require insulin is why we don't use these terms anymore. And the other thing I'll just add is part of the management regime for a diabetic is to keep your blood sugar levels at a nice, manageable range. And as Mike spoke about earlier, one of your tissue types in your body, which makes up a huge volume of tissue in your body, is your skeletal muscles. And when you're at rest, your skeletal muscles actually need insulin to put glucose into them. When you actually exercise, so when you move your muscles, they actually become insulin independent. So they can actually suck in glucose whilst you're exercising. And actually to a point, let's say if you did a fairly rigorous exercise regime during the day, they might stay insulin independent for the rest of the day. So that's actually a good way to keep your blood sugars lower by exercising more.
Okay. Good to know. ABC Radio Brisbane and Queensland, we're talking about diabetes tonight with my human body experts, Dr. Matt Barton and Dr. Mike Todorovic. Unmanaged gestational diabetes. Now, I had gestational diabetes. I also have polycystic ovarian syndrome, which can be a bit of a marker as well for somebody who might be prone to type 2 diabetes. Now, I was diagnosed with it, so I knew to be very careful. But if it's unmanaged, can gestational diabetes be harmful to the baby?
Yeah, it can actually be detrimental both to the mother and the baby. But just a quick background on gestational diabetes. So what this is essentially a glucose intolerance that begins in the first case in pregnancy. So this is what happened to you. Is that what you said, Kelly?
Yeah.
Yeah, okay. So this usually happens in the second or the late second to the third trimester. And it basically results in the mother not being able to manage the spiking of blood sugar. So what is essentially happening, the placenta that's feeding the baby is also producing a whole lot of hormones like cortisol, estrogen, progesterone, and a whole host of other ones. And what this does is actually makes it harder for you to process or put sugar into your own cells, which then means your pancreas has to produce more insulin. And so for some mothers, like you said, you had a history of polycystic ovary.
Yeah.
Is that correct?
Oh, yeah.
So that also that already puts you in a heightened risk of glucose resistance, or should I say insulin resistance. Okay. And so that makes it harder for your pancreas to start with. So for some mothers, and looking in Australia now, you're looking at 9 to 14% of all pregnancies in Australia, mothers will develop this form of diabetes. So it's becoming common now. But essentially what's happening is the pancreas just kind of can't keep up with the demand that's put on it. Now, as a result of having that high blood sugar, there are some potential complications that may happen both to the mother and the neonate. Firstly, for the mother, there are higher risks for what we call preeclampsia, which is an unmanaged type of blood pressure. There's a higher risk of having to require C-sections, and then there's a higher risk of the mother developing type 2 diabetes later in life.
Tick, tick, tick.
So
I shouldn't laugh, but it's just like, did that. Yep.
So part of the reason why it's an increased risk of or increased likelihood of C-sections is because actually the baby is more likely to be bigger, and that's partly because of the high amount of sugar in the blood for a longer period of time. So I guess the growth of the baby is enhanced.
Yep.
Now, as a result for that, there is the likelihood that the baby will be preterm, which can have some risks of respiratory distress syndrome, because any baby that's born preterm, their lungs are usually immature, and that places them at a risk of some respiratory complications.
Yep.
But one of the other most common complications that may happen to the baby is what we call, which is surprising, it's actually hypoglycemia, which is low blood sugar at birth. So I would imagine what's happening is the baby is used to processing high amounts of sugar for the whole term, and now it's been born, and now it's kind of got to do it solo.
Yep.
And therefore it's resulting in a drop in blood sugar. And also for the baby, the baby's got a higher risk for obesity and type 2 diabetes later in life.
Yeah. You know, it's interesting too, because that like two people in the same family, and I know this from having talked to, in my experience in my family, Craig, we'd eat similar things. No, not even close to being diabetic, not even close. And my doctor's the same. Her husband has diabetes. She said where they eat all the same things and she doesn't. So is there a genetic component to this as well where you're just going to be more prone to it? You may not get it, but you're going to be more prone to type 2.
Yeah, I think with most things, there's going to be a genetic component to it. And so there's definite evidence that both type 1 and type 2 diabetes have a genetic component to it. And so it may increase one's likelihood, like you stated, or decrease one's likelihood. So what we think about is the genetics is the background, and then everything you do is the environmental interaction. And so everything kept the same. If genetics was the same, you would assume that the environment, so what you eat, what you do, how much you exercise, would be the main culprits here, and that if one person developed diabetes, so would another with the exact same diet. But because genetics are different, it can change the likelihood or risk factor of an individual.
What happens if you leave diabetes untreated?
Yeah, so there's two kind of ways you can look at it. This is the chronic causes and the acute complications. So chronic just means the long-term complications that go with poorly managed blood sugar over long periods of time. And the way that they kind of categorise the chronic complications is macrovascular and microvascular. Macro just means big blood vessels. So this would be causing diseases in organs with big blood vessels like heart disease, brain, and peripheral vascular disease, which is like feet. This is part of the reason why some diabetics might get their feet amputated or toes amputated, because they get kind of necrotic tissues right at the end. And then we have the microvascular complications, which are the small blood vessels, and this would be affecting eyes, kidneys, and nerves. And so these are the chronic complications. And then with that said, I think we asked you a question at the front end, is type 1 more serious or dangerous, or something like that, a more serious form of diabetes than type 2? Well, probably the simple answer is it's hard to say. they both can be serious. I mean, go back, I'm not sure exactly the date, but when they discovered insulin for the first time and its use, being a type 1 diabetic would have definitely been the most dangerous form. You would have just died as a child and you would never have survived. But when we discovered insulin and its use, the children started to be able to survive and have a good life. Okay.
They just woke up, didn't they? The story is that they just went and injected these kids and who'd fallen into diabetic comas, and they woke up.
Amazing.
Yeah, it truly is.
One of the big differences between type 1 and type 2 is with type 1, it's usually diagnosed in childhood, which means you've caught the disease pretty early. Whereas in type 2, it's probably been manifesting for decades upon decades without you knowing, because it's subclinical, which means you've had high amounts of high sugar in your blood for a long period of time without really having a symptom, unless you took did a blood test, you wouldn't know, which then means you have all these macro and microvascular diseases manifesting without ever knowing. Whereas type 1 diabetics, they could potentially manage it well for their life, if that makes sense. So in terms of the chronic complications, I'd probably imagine type 2 diabetics might have a bit more of a risk in that case than type 1. But when we go to the acute causes or acute manifestations, there is a condition which is usually how type 1s present to emergency for the first time. And it's a state called diabetes ketoacidosis. You might have heard the term keto diet.
Yes.
So this is a diet, Mike might be able to help me here, but a diet where it's high amounts of fat and no carbs. Is that right, Mike?
Low carbs.
Low carb. Yeah, high protein, low carb.
So what's happening with these diabetics is because they've got no insulin, their blood sugar's super, super high, but their body thinks they're starving. So what they do, what their body does, is it starts to recruit fat. So this is why type 1 diabetics, they lose weight, is because they're pulling out all their fat stores because the body thinks they're starving, and it just sends all this fat to the liver, and the liver kind of can't keep up with that amount of fat, and it kind of changes it into ketones. And this puts them into an acid state, and that can be very dangerous, if not. That probably was the reason why they went into the coma.
Yeah.
And so this is usually one of the first ways that a type 1 diabetic presents is this case. And this can actually be, fatal.
All right. Lots of information there on diabetes tonight from Dr. Matt Barton and Dr. Mike Todorovic from Dr. Matt and Dr. Mike's Medical Podcast, and check out their YouTube channel as well. Gentlemen, thank you so much.
Thanks, Cal.
Thanks, Cal.